Amid rising temperatures and the ongoing heat wave, you might find yourself feeling extremely tired, falling sick too often, and even have a loss in appetite. You could also have problems like the fatigue, abdominal pain, nausea, or diarrhea. But do not just dismiss these as a result of the scorching heat, because these could also be symptoms of COVID-19. Of late, even headaches have been emerging as the dominant symptoms of the virus. Now, your fever, cough, sore throat, shortness in breath, and loss of smell and taste, these are symptoms of COVID that we all know about. But as we brace ourselves for the alleged fourth wave of COVID-19, there are newer symptoms that are surfacing among those who are affected. The virus evolves with each new wave and each new variant, and with that, it highlights new symptoms among its patients. Doctors have observed symptoms like nausea, vomiting, stomach cramps, frequent motions, watery stools, and even lingering joint pains as common symptoms of COVID. In Delhi, diarrhea was a common symptom in almost 20% of all reported cases. But most patients do not go to the doctor or even get themselves tested because they don't associate diarrhea with coronavirus. The WHO is also investigating a possible link of COVID with the recent outbreak of hepatitis among children. Clearly, the coronavirus is not restricted only to the respiratory system. The virus affects multiple other organs of the body, including the skin. Now, your most skin-related issues are commonly confused with the impact of the summer season. But it's also important to be able to differentiate between skin conditions caused by COVID and other diseases. Here are some signs of COVID-related skin rashes that you can watch out for. The first one, a chickenpox type of rash that starts around the elbows, knees, and the back of the hands and feet and then spreads to the entire body. The second is a hive type of rash that's extremely itchy and can appear out of the blue anywhere on your body, including the thighs or back or face. Now, there's a prickly kind of heat rashes that appear like red bumps. They can be slightly swollen and cause an itchy rash. They mostly appear on your elbows, knees, and occasionally at the back of your hands and feet. Sometimes they may also be filled with fluid depending on the severity of the condition. Now, your chilblains or the inflammation of blood vessels on your skin can cause itching, red patches, swelling, and blisters on your hands, feet, and sometimes on your legs and face as well. The new symptoms, how the virus is evolving, and what to keep an eye out for amid all of this can be very confusing. So what preventive measures can you take to protect yourself and your family ahead the alleged next wave? First, and the big one, vaccination. It's very important for all individuals and now children to be fully vaccinated. Keep an eye out even for a minor inconvenience in your health and do not dismiss it as a result of heat or anything else. Do not take any symptom lightly and do not sit around waiting for something big to happen to consult an expert and get yourself tested. Even in cases of mental exhaustion, don't just overlook it as a result of a difficult time. COVID is also known to cause brain fog and mental discomfort. Seek immediate medical attention when you have trouble in breathing, pain in chest, dip in oxygen levels, or a change in your skin color. Although the new symptoms of the COVID variants do not seem as serious right now compared to the previous waves, which were more fatal, it's still important to always be aware and take the right measures. And of course, the last one. It's too soon to put aside your mask. Avoid crowded places, take steam and drink hot water whenever needed, and always maintain social distancing. Remember, COVID is not over.